this episode, we're going to focus on the lumbar stenosis. And my guest is Cal Cadman, who is a medical device representative. He's worked with various companies, and I find it interesting how people get into their careers. So we'll introduce Cal and maybe have him talk about how he got into the field that he's doing and how he helps our patients.
Hello everybody. As Dr. Q mentioned, thank you for the introduction.
Of course.
I work currently with Virtuos Medical, but have been in the medical device field for a little bit over 7 years. I started out selling EMR equipment. That's where you actually, when you get into the physician's office and they're able to pull up all of your information via the computer, where all of that is stored. That's where I started. But my love for medicine and my interest in it started even prior to that, just as I'm sure Dr. Q's did. As a young child and through high school education and college, I always had an interest in the medical field. So when I was able to work with that EMR company, I was then able to transition into pain management, into some very interesting devices. I always found pain management extremely interesting for a couple reasons. Pain affects and will affect most people, whether it be early on or later in life. And being able to treat that in very creative ways is something that's extremely interesting in a field that can help millions and millions of people. In partnering with Dr. Q in Pennsylvania Pain here, we've been able to bring a number of those modalities to their patients and have been very effective. So it's been a rewarding field. Working with Dr. Q is one of the best parts of that. And then also working and seeing how much better his patients do with some of the devices that we're able to bring to them.
Right, because I think commonly when patients hear about pain management, they think, well, these are just physicians that prescribe medications and opiates and all those things. But in fact, we actually, especially here at the Pennsylvania Pain and Spine Institute, and myself, we like to focus on cutting edge technology, which is why we wanted to talk with Cal today, because there's been really some tremendous technological advances in the field of using what's called minimally invasive treatments. Traditionally, for many of the pain conditions, patients end up having these really big surgeries, and when we track the results of the surgeries, we find that most patients who have these surgeries don't really get good outcomes, and they had to undergo these big surgeries. They had to undergo general anesthesia. They, from a healthcare dollars perspective, we spend, just an exorbitant amount of money on these surgeries without really good results. So, as we've all experienced, with technology, our iPhones have gotten smaller and prettier looking. So, in the same line, we've looked at medical procedures for pain relief, and in the same way, we've developed some newer things that can help with these conditions in that same respect. So what Cal's here to really talk about with me today is a good treatment method for a condition called lumbar stenosis. So Cal, do you want to talk about the company a little bit, its history, and how long this new revolutionary procedure has been in existence for?
Absolutely. So as our population gets older, and you can even relate that to parents and grandparents of the patients that you see within your office, we're all looking to remain as mobile as we can, whether that's playing with grandkids, children, family members, or just remaining active within your community. All those are extremely, extremely important to everyone as individuals,
right?
Us included.
Right.
So what Virtuos set to go out and kind of solve and help patients and people with was the ability to walk and stand for longer periods of time and longer distances, and do so in a minimally invasive approach.
Right.
As Dr. Q mentioned, there's a lot of treatments out there that require overnight hospital stays and large incisions and long recovery times, quite frankly. So what Virtuos did about 2.5 years ago, we partnered with large insurances, and we set to develop and put out a clinical study that showed the efficacy of what's called the mild procedure, as Dr. Q mentioned.
Well, I think first, before that, maybe we should talk about what lumbar stenosis is, and then sort of we'll kind of trace back to Cal and talk more about the mild procedure. Lumbar stenosis, I think most individuals, unfortunately, over the age of 60 and 70 start to suffer with this condition. They may not know what it is, but they all start to complain about the same problems. They usually will say, before they could walk miles without any problem. They can stand for hours without any pain. But then suddenly they start noticing slowly over time that they can't walk as much, that they can't stand nearly as long. And they notice that when they do walk or stand, they start to bend forward, sort of like in this position. Because when they bend forward or when they sit, their pain goes away. And I'm sure most, if you talk to your grandparents or anyone over, the age of 60, they start to tell you that they have this element. So what that is due to is really, what I tell patients, sort of the natural progression of the aging of our spine. Unfortunately, our spine has, so this is what our low back looks like in this model here. Our low back consists of major bones, so 5 major bones that sit one on top of each other, almost like Lego blocks, and these are called the vertebral bodies. They support our spine, and at the same time we have discs that sit in between to help essentially cushion the bones and to provide support. But the most important thing that we see is, or the most important element that we have in our spine are nerves. We have nerves that travel from the back that goes down to the legs, so that's how our body controls the legs. And we also have the spinal cord, which is by far the most important nerve in our whole body, that is in a central canal that travels from our brain all the way down to the back, and that gives our brain the ability to control the whole body. As we get older, the canal space where this nerve travels through gets smaller over time, and it is unfortunately a natural thing that happens with aging. Certain things make it move faster. Certain patients that have a genetic reason, like some families just have more arthritis and degeneration than others. I find often that patients who work in labor-intensive jobs where there's a lot of wear and tear on their spine, they may get this faster, but essentially the space for that big nerve in our spine gets smaller and smaller and smaller as we get older. So when there is constant pressure on the nerve because the nerve is getting squeezed from this aging process, it makes it so that we can't stand upright and we can't walk. Because when we're in those positions, there's just not a lot of space there. And so as a result, patients start to develop significant back discomfort, pain into the buttock area, and they'll tell you that they can't walk even the length of a parking lot. But at the same time, they always have what's called a shopping cart sign, which is what we talked about, where if they go to the grocery store and the patient gets on the shopping cart and they bend forward, now all of a sudden they can go throughout the grocery store. Mm-hmm. So when patients come and tell me these signs, to me that's a big light bulb that says the patient has what's called lumbar stenosis, and so that is the condition that we're really talking about. And I think if we're lucky enough to live long enough, most Americans and most of us will unfortunately have to deal with this. And so
say, Dr. Q, that I'm a patient who comes into your office
right.
and describes myself as trying to be as active as possible, but I do have difficulty standing for maybe longer than 15 or 20 minutes, and I'm unable to walk more than really maybe to the mailbox and back at my house, or maybe even just to the car and back and do small activities around my house. What are maybe some procedural options they might have within your practice or even outside of your practice that might get offered?
We always try to do the least invasive things when it comes to medicine. Like we stated earlier, I'm just not a big fan of jumping to surgery. So if someone has enough, if someone comes to me and they haven't had any treatments, sometimes we'll prescribe things like physical therapy. And then there are some nerve pain medications that aren't opiates that target these nerves that are getting squeezed. And so I usually would recommend things like that. If that doesn't help, there are injection options where we can inject anti-inflammatories right to where the nerves that are squeezed to try to decrease or to try to reduce the swelling around the nerve. That way it frees up space for the nerve. And there are, for patients that have mild spinal stenosis, they do get quite a bit of relief. But it's what we call in medicine palliative, which means that we are not fixing the problem, but we're making it so that patients can live with this. And that's most of the treatments that we do in chronic pain management, because we're really dealing with trying to fix the aging process, which there isn't. And so often our frustrations in the field were that, we would do an injection, the patient does feel really good, but sometimes it's only for a week or a month. So that's when we wanted to start looking for treatments that can last much longer than that.
Now, even say my grandmother has recently been to a surgical consult and was offered a very invasive laminectomy and laminotomy by a surgeon. And she deals with the symptomology very similar to the patients we're discussing, with inability to stand for long periods of time, inability to walk for long distances. Talk a little bit about those procedures, maybe what they're trying to accomplish,
of course,
and maybe some reasons that patients might decide to go a different route for those.
Well, so those words that Cal just used, laminectomy, laminotomy, they are all what are called, or what falls under a decompression type of surgery. The idea is to make space for the nerves. So I know for those audio listeners, it's going to be hard for you to see the model, but I'll try to explain it as much as I can. Essentially, we have a piece of bone that covers over the nerve called the lamina. And this bone is there to really provide support for the spine. And we have a piece of lamina that goes on every single level of the low back. And I usually refer to this as almost like rungs of a ladder, and with our back being the ladder. So often when patients go to have surgery for this, the surgeon will cut out either half the bone, or sometimes if they remove the whole bone, they have to put in more hardware to support it. But even if they cut out just a small piece of the bone and do what's called a laminectomy or a foraminotomy, that temporarily does create space for the nerve that may be pinched. But at the same time, imagine a ladder where someone goes in and saws off half of the rung. Well, that ladder is no longer stable. So now, over the next few years, the rate of degenerative changes, or arthritis and things like that, will greatly accelerate. And so that's why personally, I'm not a big fan of these type of surgeries. And also, again, as I stated earlier, they're usually done under general anesthesia, which means they carry a lot of risk, especially for patients who have this lumbar stenosis condition, because like Hale said, this is his grandmother, who I imagine is at least in her 70s and 80s, and we don't want to see our loved ones have to undergo general anesthesia, especially for a non-urgent surgery such as this, because they can have a lot of long-term issues. And so, as Cal was saying earlier, that's why we typically try to avoid referring patients for these surgeries unless we have to. And unfortunately, before the mild procedure came out, that was sort of the only option we had when patients did not respond to injections.
Right, so what she was described at with in a physician's office was similar to pinching your fingers along a drinking straw. As Dr. Q mentioned, that compression in your spinal canal in your back that's causing that pain and tingling and numbness, whether it be in both your low back and down your legs. So if I'm fair to believe, removing that piece of bone, removing that lamina kind of frees up that space.
Correct.
Was kind of the idea of that.
Correct.
And then what she was also told was that there would be probably at least a 3 to 6 month recovery with overnight stay in the hospital.
Yeah. And that's never good for an older individual, because every day that we're laid up in a hospital bed, we lose about 1% of our strength. And for an older individual, it takes days to recover that. So that's why often, when an older individual has surgery or is laid up for months, they usually never recover. So
now, again, what Vertos set out to do was to find a minimally invasive way or approach to remove that impingement on that same drinking straw. So again, it is a safe, effective procedure in which you're able to treat or help patients with lumbar stenosis, ones that are looking to walk for longer distances, stand for longer periods of time. And we're not going to be doing a 6-inch incision with removing pieces of your bone that destabilize the spine.
Right.
We're able to do so with between a 5.1 millimeter portal, it's about the size of a baby aspirin.
Right.
And we're removing that same impingement or that same pinch of that drinking straw. So maybe talk a little bit about your experience, or maybe the procedure itself and what you've seen thus far with the mild procedure for your patient.
Well, the mild procedure stands for minimally invasive lumbar decompression. And when I first heard about it, I thought this was very revolutionary, because we all see a lot of advertising, and there are places that are saying that, if you have back pain or lumbar stenosis, they can fix you with a 1-inch incision.
Right.
And when Vertos had told me that there was essentially no incision, and very limited anesthesia and things of that, I thought it would be a great procedure. And when I looked at the idea of what the procedure was, I thought it was very ingenious, because essentially what happens is, instead of going in with a large incision to go down to where the bone is to take the bone away, they actually invented a device that is essentially it's called a portal. It creates a space so that I can then take a tool, and I use the tool and go down, and I can sculpt the bone around it. So I'm not taking away the whole bone at all. In fact, I'm just taking tiny pieces right by where the nerve is, or where the nerve is pinched, or sort of where that straw is getting crimped, and that there's no flow through. And by just taking away a tiny, tiny bit of bone, it opens up the straw. And after that, I take a second tool that goes down and removes the tight ligament, which is a soft tissue structure in our spine that also compresses the nerve. And with those two tools, it drastically increases the space for the nerve. And in my experience now, I've done quite a few of these cases, and I don't think it's taken me more than 15 minutes for most of these cases. And the benefit is, unlike most surgeries which are done at the hospital, these are done at a surgery center. The patients are there for an hour. I did some cases with sedation, where it's just like when you get a colonoscopy, where you're nice and relaxed. I've done some cases where the patients weren't even sedated really, and it was just done under what's called local anesthesia with lidocaine solution. The patients were able to go home within about 30 minutes. And I just saw a patient today who had done this procedure 2 Fridays ago, and she told me that she couldn't walk into the surgery center, but when she recovered from the procedure, she was able to get up and walk all the way to the parking lot to recover without any discomfort, which was really, quite a dramatic improvement for her, especially for a 15-minute procedure.
That does sound excellent. So again, no sutures, no stitches.
That's right.
No general anesthesia.
That's right.
No overnight stay. Let's talk about the recovery after the procedure. You saw patients back in your office in 2 weeks.
Yes.
They're going home that same day. How would someone normally feel, in your experience, maybe a day after mild, and how long until they're kind of feeling back on their feet, back like themselves?
Well, I think, so most of the patients I've talked to after the procedure really did not complain at all about any post-procedural discomfort. They said it felt just like an injection. And like I said earlier, the one patient actually felt a lot better after the procedure, especially immediately after the procedure. So she didn't really have much soreness at all. I would say that if anything, most patients may feel some soreness, just like an injection. So I usually tell them to ice the area. They can take like a Tylenol or something if it bothers them. And then usually, I've been doing them on a Friday, so by Monday, they say they feel completely normal and they have that nice improvement.
Now, I heard a story from you that actually one of the patients who we performed this on a Friday actually walked out to their car.
That's right.
After the procedure.
Yeah. And then I had another patient who'd been treated for a long time with me, with a lot of injections and ablations and some higher level procedures. She had this ongoing pain in her thigh all the time when she was standing and walking. She came back for a follow-up after the procedure, and she said she was almost pain-free.
That's excellent.
So, for a 15-minute procedure, I think it's pretty dramatic compared to, all the stuff that goes into back surgery.
Absolutely, and that's very in line with what Virtos saw with their clinical study.
Right.
They performed it on over 300 patients nationwide, and they looked at 3 main pillars, just as you described: effectiveness, safety, and obviously then outcomes. So what they were able to see was the same as you. That it's they had a 100% non-complication rate, so 100% safety rating. They were able to get patients standing for longer. Patients went from 9 minutes to just over an hour. Walking distance was dramatically improved, 256 feet to over 4,000.
Yeah, that's. Whenever I talk to patients about this, I sort of talk to them about these numbers. Like Cal was saying, to go from walking 200 feet before to almost 4,000 feet after the procedure. That's insane. Most of the patients I talk to, they said they can't even walk 200 feet in the first place. So they're quite excited about the results. And I think, Cal, do you recall the effectiveness rate of this?
Yeah. So patients during the study had a 94% non-reoperation rates. We were helping patients at a 95% clip avoid those more invasive procedures that you saw, the laminectomies and laminotomies. And then we also saw about a 50% reduction in patients' pain over that course of time as well. So it was an extremely effective procedure. Now, of those 300 patients, the effectiveness, what you're referring to, how many patients responded?
Yeah, because patients all want to know, like, what percentage, am I going to get relief from this?
Correct. So the responder rate during the clinical study was 79%. So
79, that's pretty good.
Very close to 80% of the patients who mild was performed on had the results that you and I were just speaking of.
What about back surgery? Do you know, like if someone had back surgery, what are the chances that they may get relief from this?
So right. So of those 300 patients, again, Vertos didn't cherry pick them. That they didn't have maybe prior fusions, laminectomies, laminotomies, those more invasive procedures. They were absolutely 100% included within the study, and then those results speak for themselves. We don't anticipate most patients to come without those types of procedures either being offered or maybe even performed on them in the past.
Yeah.
Mild can still be an effective solution for those patients to stand for longer periods, walk for longer distances, even if those procedures have been performed on them in the past.
But I think, when patients are asking, should I have major back surgery or should I try the mild? I think it's a no-brainer to try the mild. I mean, why would you not want a minimally invasive type of treatment versus something that's very invasive?
Right.
And that's sort of, in the field of pain medicine now and interventional pain management, we're constantly looking for treatments like the Vertos procedure to really try to provide it for our patients so that they can have these really nice interventions without all the baggage that goes with the standard surgeries.
I always think a huge seal of approval for you and I is if we would recommend it to a family member.
Of course.
And certainly with what interventional options that Dr. Q provides, Vertos being right at the top of that list for, again, my grandmother, those suffering from lumbar stenosis with the inability to walk and stand, mild is absolutely something I would recommend to family members and friends alike and those patients within Dr. Q's practice.
Like I said, there's no incisions involved in this. It's 15 minutes long, and you may be able to walk from 200 feet to 4,000 feet.
Right.
And stand much longer.
The mailbox to, over a mile is quite a considerable difference.
It certainly is incredible. And here at Pennsylvania Pain and Spine Institute, we really pride ourselves as one of the only practices in this entire region that provides this wonderful procedure so far. I've been doing these cases ongoing now for the last few months, and I'm probably one of the highest, the highest volume practitioner in this area. So we're very encouraged by it, and we really love this procedure.
Absolutely. So Dr. Q, as one of the only ones offering this within your practice, really here in the tri-state area, again, going back to some of the results you've seen with patients, if mild is performed, and then these patients say within a couple years down the line, what do you anticipate the results to continue to be, and do you see maybe a need for a reoperation or anything in the future for them?
Well, I think most of the time what I tell patients is that they get the greatest relief probably around the 3 months mark, just like if they had a surgery, right? Because not all patients get that instantaneous relief. Of course, I hope that they all get that, but most, some patients, they start feeling relief, and then it gets better and better and better, and it peaks typically around 3 months. And then after that, it's really sort of, again, what we're dealing with is aging. Patients are living longer and longer and longer. So if I go in and I open up the space for the nerve, but they're being more active now, they're doing things they couldn't do before, they're playing with their grandkids, gardening, all this. Yes, they could have, they could start to tighten up again. But the great thing about the mild procedure is it could be done repeatedly, because all we're doing is we're going back in with a very small tool, and we're sort of taking out those bone spurs that are developing, and the calcified ligaments that are there from aging. So so far I haven't had to go in yet to reoperate on a patient, but I always tell the patients that it can be redone if needed. And I'll tell you, today when I told the patient that if she wanted to, we could go back in at some point. She was very happy about it because she was so happy with the results now. She almost wants to try it again at some point to see if she gets more. Whereas, I would want to only do that if I thought it was indicated clinically, if she was having more pain again. So.
Yeah, that's excellent and great to hear. Again, that patients may be suffering from this disease later in life, and to your point, as you become more active, it's possible to reperform the mild at that same level or different levels for the
patients. I mean, that's what we're ultimately dealing with now in chronic pain, is that we're really dealing with diseases of aging. People are just living so much longer than we've ever dealt with in history, and so we're seeing all these new conditions and problems that we just didn't have to deal with 50, 60 years ago. And so I think a new technique like this is really something that fits the bill in terms of getting the best bang for the buck.
That's excellent. And again, as one of the only physicians in the tri-state area offering this procedure, you can visit the website. Any last remarks for any of the patients, Dr. Q, listening? We certainly went over a lot.
Yeah. No, I'm quite excited by the results so far, and especially given the minimally invasive nature of it. There's very little to lose, but so much to gain from this procedure. So I'm really excited to have it for my patients here at this practice, and we look forward to doing more of these cases and really continuing to being a center of excellence here in Montgomery and Bucks County in Pennsylvania. And we certainly welcome any questions or concerns afterwards. I could be reached at my office phone number, which is 215-395-8888.
Excellent.
And we thank Cal for being with us today. And again, Cal is from Vertos Medical, which is a cutting-edge medical device company that focuses on using minimally invasive techniques to reduce chronic medical conditions such as lumbar stenosis.
Thank you very much, Dr. Q, and thank you, everyone.
Terrific.